So there are several exciting developments. So in terms of the clinical trials, I like to break it down according to the different sort of drug classes. So as for PRRT, or peptide receptor radionuclide therapy, I think we have a couple of exciting trials there. So one is a trial comparing PRRT with everolimus. I think will be very helpful in telling us how to sequence therapy. So right now we have everolimus, which is an active drug. We have PRRT, which certainly is a very active treatment, but we don't necessarily know how to best sequence or line these two drugs up. So I think that will be an important trial to get done. Another trial is a PRRT study looking at a somatostatin antagonist, which has a higher affinity for the somatostatin receptors, essentially sticks to it better than the agonist does with lutetium-177 radionuclide. So that is a phase 2 dose finding study looking at tolerability and with efficacy as a secondary endpoint. I think that will be an important study too. So that's what's going on for PRRT. In terms of other drugs, probably the most important trial right now is an alliance study. It's a phase 3 trial of CabosAnthony versus placebo. So there are very encouraging phase 2 data from CabosAnthony in both small bowel neuron tumors and pancreatic neuron tumors reported at GI ASCO almost 2 years ago. So I think that is a very natural choice for a phase 3 study. And then there are some other earlier phase trials with interesting compounds, some recognizing the somatostatin receptors and others targeting different parts of the neuroendocrine tumor cell machinery.